Hi Lois, I'm Dr. Lucia Bonilla. How are you today? Okay, I'm more than happy to help. Before we proceed, I have to admit something. I've never worked with a deaf patient and an American Sign Language interpreter before. Should I speak directly to the interpreter and the two of you can communicate with each other? Okay, is that how it works with deaf people? Okay, this is my first time, so just please let me know if I do anything wrong. So you mentioned that your current medication is not working, is that correct? And your previous doctor didn't change your prescription? What prescription are you taking? I see. How often do you take these medications? Just once a day when you get a headache? Okay. And it's not working?
No, it stopped working. It did work, but now it's not working. And it's just very frustrating because I've been taking it and all of a sudden now it doesn't have any effect on.
Well, that's terrible. That's something we need to fix. Did you ever take any other medication over the last 5 years? That test you mentioned, did Dr. Long tell you that you had depression or anxiety or anything like that? Do you feel depressed lately? I see. Have you ever had any suicidal thoughts? Have you ever harmed yourself? And have you ever thought about killing yourself or harming yourself at any time in the last year or 5 years or any point in your lifetime? Okay. I'm curious, what do you do for a living? Oh, that's cool. Do you have any dreams or ambitions? Well, that's a great goal to have. How is your personal life? Congratulations on both. Do you feel stressed out about either of those things? I understand. Life seems to be going great for you. Do you smoke? Do you drink alcohol? Okay. Let's get back to your medications. Do you remember the names of the medications Dr. Long prescribed you over the years? Citalopram. Yes, it's a common medication for depression. How long were you on that one? And why did you stop? Do you remember how many milligrams you took? Okay, how long did you take sertraline? And why did you stop taking that one? Okay, how many milligrams of lorazepam did you take? And how long were you on that? Please explain. Okay. I'm sorry to hear about that. That must have been hard to go through for 6 months. Did you ever have any vision issues while taking lorazepam? And can you continue taking this medication then for your headaches? Okay. Well, thank you for the information. Do you feel like you need any help with your mild depression? Okay. You don't seem like you're struggling with depression. However, I want you to come to me if you ever feel like you need help. I don't want you to feel afraid to come to me about depression. I won't hurt you. I'll do everything I can to help you if you ever feel like you're struggling with depression, okay? Anything for you. I want to get back to the vision loss that you mentioned just now. So, had you experienced that either before or after you had taken the lorazepam? Do you ever get headaches after seeing those spots in your eyes? Do you get headaches the day after you have those vision issues? Okay. Does this medication help the headache go away the next day? Okay. When or what kind of headache does this medication help with? Okay. Tell me more about the spots in your eyes. Do you ever find it hard to balance? Lois, you're experiencing migraines. No, your symptoms fit the description of migraines. Well, everyone differs with their description of pain. The vision loss that you experience is called, in layman's terms, a visual aura. Migraines often attack after you experience a visual aura. And you said you would get headaches the next day after having those vision problems. That's what migraines are like. Migraines can also cause or include depression, and you have a history of that. Well, I'm sorry about that. It seems like maybe Dr. Long wasn't the best help you could get for your headaches. Maybe that's the reason why you couldn't get a proper treatment for so long. I want to run a few tests on you, okay? Just some simple breathing tests. So take a few deep breaths for me. And again. Again. Once more. Okay, now just breathe normally. Can you swallow for me? And I want you to follow my finger, just with your eyes. Leave your head where it is. Okay? Okay. Well, you don't show any signs of brain tumors. Your symptoms point to a common migraine. I don't think you have a brain tumor. I just wanted to be sure. Don't worry, everything's okay. Do you drink caffeine? Okay, what kind of drink do you get at Starbucks? Okay, so did you know that your current medication has caffeine in it? Caffeine can help with migraines, but it can also trigger a migraine. I'd like you to have only 1 or 2 cups of coffee in the morning and then nothing during the day from now on. Okay? And please try to drink coffee without sugar. That means no frappuccino. Caffeine helps migraines, but a lot of sugar doesn't. It's bad for migraines. So just drink coffee without any sugar. You can use an organic sugar substitute for now, or just drink coffee with cream in it. Just no drink with too much sugar in it. You'll get used to it. Chocolates can trigger migraines, and it seems like you may have chocolate regularly with the Starbucks drinks. So avoid that and don't eat too much chocolate. Sure, you can. Just try and keep it under 2 times per week. Do you eat cheese? Good. So try adding more orange, yellow, and green vegetables to your diet. And rice is also a good idea to add. You seem to have a good job. Is it stressful? Okay. Stress can also trigger a migraine, so talk with your boss and see what you can do to reduce stress in the workplace. I can also tell you it'll help if you do a self-evaluation on your work lifestyle. Try to figure out what it is that stresses you out the most and then take steps to reduce that stress in your work life. I'm going to give you a prescription for sumatriptan. Take one of them anytime you feel a visual aura coming on, and that medication should help you a great deal.